Time to get started. I'm gonna say like the news is 2 minutes. 2 minutes. Got to go live. Hey, baby, hey, got to go live. Hey. I'm sorry, you about to put on? It is. I'm from Paris. I'm sorry, man. Got to go live. Hey. All right, you ready?
All right. Good evening. Good evening. Good evening. Yes. Good evening and welcome to our 2022 World AIDS Day program and balloon release. I am Veronica Washington, Interim Deputy Administrator for the Ryan White program. Thank you. Every year, this is an exciting time for us to come together and honor and support the people living with HIV and commemorate those we have lost. You are in for a tremendous program tonight. We have put a lot of work into putting this together, and I promise you this is a labor of love. It is a labor of love. I have to thank our Ryan White team. Go ahead and stand up. I always say this is a group of hard-working people here. We work hard. I also want to thank HCAP, our vendors, our volunteers, Dr. Taylor, Dr. Randolph, our HIV testing agencies, and each of you for coming out tonight. As I said, we're going to have a good time. So without further ado, now I'd like to introduce our Master of Ceremony. No stranger to the Mid-South area. He communicates on and off the air. He has become, one of Memphis' most energetic and beloved radio personalities for 29 years now. DJ Stan Bell. Stan Bell received his undergraduate degree in mass communication from UT Martin. He received his master's and EDS degrees from Union University in Jackson, Tennessee. He is a member of Kappa Alpha Psi Fraternity Incorporated, and he is also professionally involved with Kappa Delta Pi, an international honors organization for educators. Stan is a past recipient of the Distinguished Role Model of the Year Award presented by the Memphis Alliance of Black School Educators. Stan is truly a family man with a loving wife, Carla. He is also the proud father of 3 brilliant and handsome sons, Matthew, Miles, and Micah, affectionately known as the Baby Bell Ringers. DJ Stan Bell. Where'd he go? Oh,
That's good. Thank you.
Thank you. It's you. It's your show now.
That's pretty good there. All right. Thank you, Ms. Washington. Give her a hand, y'all. That's how you bring up a DJ. That's how you bring up a DJ. Thank you so much. Thank you. Hola, buenos dias, buenos tardes now, right? How's everybody doing? If you feel good, say yeah. All right, so, Veronica, thank you so much. My name is Stan Bell, serving you well, and pushing more power than a Duracell. I thought somebody would help me finish that. Dr. Taylor, I know you know that part, right? You've been on the show before. So let me do it like this. Can I be heard in the back? In the back, throw your hand up. Okay, cool. Okay, I'm about 5'11", so I'm gonna raise the mic up a little bit higher. All right. Shelby County Health Department, make some noise. Come on, Shelby County Health Department, make some noise. Come on, talk to me. 814 Jefferson. Is there another location? Is there another location, Dr. Randolph? What's the other location? Downtown, South Memphis, East Memphis, everywhere, all over, just ubiquitous. So look, I just bring you greetings on behalf of all those radio stations I work for. I think many of you know that I'm part Haitian, part Jamaican, and I like to work. So, you know, I'm like you all at the health department. I like to get it in. I like to prevent, I like to promote, and I like to protect. Y'all missed that. And I like to work. So let me say thank you for allowing me to be your agenda guide, your MC, your DJ, all of that stuff. So I'm going to be kind of jumping back and forth and introducing different people on the program. So thank you so much to Dr. Taylor, of course, Director Taylor, to Dr. Randolph, and to those who are part of the executive leadership team, and those of you who make it happen on a day-to-day basis at the Shelby County Health Department. Thank you so much for having this each and every year. Ryan White program, everybody who works with the Ryan White program, throw your hands up. I see you. Keep doing it, keep doing it. I see your hands, Shirley. I see you. I see you and your team. So we've had music. We hope you had a chance to get around to all the vendors. I do want to remind you that HIV testing will be taking place in the testing area until 7:30 this evening. Again, HIV testing will be taking place right here in this venue until 7:30. Without any further ado, I'd like to keep the program moving. I'd like to introduce a person that really needs no introduction, but I got to do it, I want to do it, and I need to do it. Our next speaking voice is a native of Live Oak, Florida. He attended Tuskegee Institute, now known as Tuskegee University, on a football scholarship, graduated summa cum laude. I can't say that. Y'all know what I graduated, right? Thank you, Laude. Yeah, I did. I graduated, thank you, Laude. From Tuskegee. Has a Bachelor of Science degree in biology. Dr. Randolph has received his Doctor of Medicine degree from the University of Florida's College of Medicine. He also received a Master of Public Health degree from Johns Hopkins University School of Public Health. He received his residency training in family medicine at the University of Arkansas, General Preventive Medicine at Johns Hopkins University, and occupational medicine at the University of Oklahoma. That's the Sooners? Is that the Sooners? Okay, the Sooners, not the Laters, but the Sooners, University of Oklahoma. Dr. Randolph is currently licensed to practice medicine in Tennessee, Arkansas, Mississippi, Alaska, Pennsylvania. You get the picture. And of course, Oklahoma, all right? He's been practicing medicine for 36 years. Come on, that's it there. 36. That's a good number, Dr. Randolph. And he's practiced in various settings such as rural health, urban health, student college health, occupational health, and private practice, public health, Job Corps Center, Indian Health Center, and the National Health Service Corps. So it goes on and on, but I wanted to do a little bit of his bio on purpose, because I think it's significant that we recognize a man who is working, a man who has studied, a man who is credentialed, a man who is in the right place at the right time. So without any further ado, would you please help me welcome the ordained gospel minister, the man who believes in holistic health, Dr. Bruce Randolph. He's going to come with some remarks, invocation, and whatever he wants to do. Dr. Randolph, everybody. The good doctor.
All righty. Thank you there, Mr. Bell. Shall we pray? O merciful and loving God, we're gathered here this evening to remember and honor those who are living with HIV and those who have transitioned as a result of this dreaded epidemic. God, we want to just pause and first give you thanks for this day. Thank you for your many blessings, for waking us up this morning, for allowing us to go about our daily endeavors. And God, we want to just thank you for the life and legacy of each and every one here, and those, God, who are living with HIV and those who have passed on. Oh God, we want to just thank you for all those who are currently committing their lives to ending this epidemic. We thank you for the workers in the Ryan White program. We thank you, God, for the various agencies responsible for the various activities. Oh God, we come asking you this evening that you would give us strength where we are weak. Give us courage where we are fearful. And give us knowledge and wisdom where we are ignorant. Oh God, we ask that you help us to overcome hatred and replace it with love. Help us to overcome stigma and replace it with acceptance. Help us to overcome inequality and disparity and replace it with equality and justice and fairness. And oh God, we ask that you help us to overcome hatred and replace it with love. Oh God, bless each and every one who's here. Bless those who are responsible for putting together this event. And we ask, oh God, that you bless the food that we're about to receive and the nourishment we derive of. This is our prayer. We pray in the name of our liberator and savior, the Messiah, Jesus of Nazareth. Amen. Amen.
All right. The doors of the church are open. Is there one? I like that prayer. Talk to your daddy, Dr. Randolph. I love that prayer. Come on, one more time for Dr. Bruce. Bruce Randolph in the building. Look, now we can proceed with dignity, honor, grace. Everything is decent and in order when you bless it like that. So again, thank you so much to Dr. Randolph, who is currently serving, by the way, as the health officer for the Shelby County Health Department right here in Memphis, Tennessee. Thank you for what you do on a day-to-day basis, Dr. Randolph. And I mean that. All right. So now we're up to the part of the program where we get to hear opening remarks and proclamation. I'd like to just say a few words about our next speaker, because I think it's vitally important that you know a few things about Dr. Taylor. As you know, she is the director of the Shelby County Health Department. She is the Shelby County Division Director for Health Services, and Dr. Taylor leads the operation of the Shelby County Health Department. She is also a lieutenant colonel and residency-trained flight surgeon in the Tennessee Air National Guard. Yes, she is. There's more. Dr. Taylor received her undergraduate degree from Howard University. Go Bisons. Back in 97. Her medical degree from East Tennessee State University, J.H. Quillen. Is that Quillen or Quillen? I got it right. Thank a teacher. College of Medicine. Back in 2002, completed her pediatric residency at East Tennessee State University, Johnson City Medical Center, and the University of Tennessee Health Science Center. So she also earned her master's degree in epidemiology from the University of Tennessee Health Science Center back in 2009, and she received a doctorate in public health administration at Johns Hopkins University back in 2015. And then fast forward 3 more years, in 2018, Dr. Taylor completed her master's degree in public administration at the Harvard Kennedy School of Government as a Commonwealth Fund Morgan Fellow. Is that Mongan or Morgan? Mongan, M-O-N-G-A-N, right. A fellow in minority health policy. So there's more. But you know what? I think it's important that we share some of that with you to let you know she is licensed, she is credentialed, she is worthy, and she is qualified for this position. Please give it up for the director of Shelby County Health Department, the one and only Dr. Put some respect on it, Michelle Taylor in the building. Come on up here, sister. Come on up. Watch this shivering. Watch this.
Look at there. Look at there.
It's not dead.
Hello, everyone. Everyone looks so good. All right, I'm going to try again. I'm going to act like Stan. Hello, everyone. There you go. Are we happy to be here tonight? Yes. So I'm going to make a few remarks, and then I'm going to read the end of the proclamation, because if any of you all know about these proclamations, there are a lot of whereases in them, but I'm going to read the most important ones, okay? Each year on December 1st, we commemorate World AIDS Day, a day to reflect on our worldwide response to HIV/AIDS while honoring the lives of those lost to AIDS-related illnesses. On this day, we also renew our commitment to supporting the well-being of those with HIV, as well as those at risk for infection. This year's theme, Putting Ourselves to the Test, Achieving Equity to End HIV, is a collective call to action for strategic innovation, engagement, and collaboration to address stigma, discrimination, and other structural factors burdening certain populations in geographic areas. And I want to pause here because we know that especially in our area, we deal with that a lot, particularly with our populations that are dealing with HIV and AIDS. Shelby County Health Department remains steadfast in our efforts to ending the HIV epidemic in Shelby County and the Memphis Transitional Grant Area, with an affirming commitment centering communities disproportionately affected. Connecting with minority and stigmatized communities is an important part of the Memphis Ryan White program work. While Black Americans represent about 12% of the U.S. population, they account for about 43% of all new HIV diagnoses, 42% of people living with HIV, and 44% of deaths among people with HIV. The Ryan White program works to achieve HIV health equity by promoting health and access to quality care for people in our region living with HIV/AIDS, regardless of their insurance status or ability to pay. The program connects eligible people to medical care, supportive services, and medications to support the health and well-being of people living with HIV/AIDS. The Ryan White Program Planning Council, which includes 1/3 membership representation from people living with HIV in our community, is an appointed group tasked with setting Ryan White Program funding priorities. And right now, I really do want to recognize them. So if everyone who is able will stand, who is part of the Planning Council, we want to recognize you. Thank you for all that you do. By engaging consumers of Ryan White services in this tremendous task, the Ryan White program gives voice and control to the communities the program supports to reach HIV health equity and end the HIV epidemic. We remain deeply committed to achieving sustained epidemic control of HIV by supporting equitable health services, testing, solutions, and research to improve health outcomes in Shelby County and surrounding regions. And I will tell you, Ryan White and the Planning Council is very unique. We wish that we strive to have programs across the health department that do what Ryan White does. And so once again, I will recognize some of the hardest working people in the business, our Ryan White program folks at Shelby County Health Department. You all go on and stand up again. You need to get used to standing up this evening. We must recognize you this evening. Thank you for all that you do. So I'm looking at this proclamation, and I think I'm going to have to read at least 2 of these whereases. Will you all hold on with me just a little longer? All right. All right. I may do 3. Whereas this theme reminds us that the burden of the HIV/AIDS epidemic does not affect all in our society equally. African Americans have been disproportionately affected by HIV/AIDS since the beginning of the epidemic. African Americans represent about 12% of the U.S. population, but account for about 43% of all new HIV diagnoses and about 42% of people living with HIV. And whereas the Shelby County Health Department's administration remains steadfast in its efforts to end the HIV epidemic both locally in Shelby County and around the globe, with an affirming commitment centering around the communities who are disproportionately affected. And whereas the Shelby County Health Department's administration remains deeply committed to achieving sustained epidemic control of HIV by supporting equitable health services, testing, and research to improve health outcomes here and around the world. Now, therefore, I, Lee Harris, Mayor of Shelby County, Tennessee, do hereby proclaim this first day of December of 2022 in honor of World AIDS Day in Shelby County, and call upon all its residents to acknowledge this International Day dedicated to raising awareness of the AIDS pandemic caused by the spread of HIV infection and mourning those who have died of the disease. Thank you all so much for everything that you do.
So congratulations to the Shelby County Health Department. Congratulations to those who are hard workers. As Dr. Taylor mentioned, hard workers, those who stood up and those who may not have been physically able to stand up. We appreciate what you've done. And thank you for all the whereases and the therefores and the herebys and the whereuntos. Thank you, Dr. Michelle Taylor. I think it was well deserved to say that, because a lot of people in this room are so worthy and deserving. You know, when she mentioned those 2 words, hard work, I said, nah, I'm not doing anything by myself. I'm not the only hard worker around here, because that's what it takes. My mic on? Okay. So that's hard work. So thank you to every county health department and who worked with the Ryan White program. All right. So we're up now. Do want to let you know that we have door prizes this evening. We got a lot of prizes and we want to give them to you. And somebody's going to walk away with some good stuff this evening. We have entertainment as well. We have our new king and the band coming a little later on. Let's give them a hand. They're going to come on in a little bit. You heard, got here a little early. They had a great sound check. It might be a short. Good? All right. Okay. So if you were here last year, remember our niece King and the band, and they did a great job, and they're back again with us this. We're up to door prizes now, right, Shirley? We're up to door prizes now? All right, let's go. Let's do it. All right. You want to try this one?
Okay, I'll do it this way.
All right. Somebody said, oh, yeah, that's better. You're like, yeah, I see your smile behind the mask. All right, so here's what we're going to do. All right, so we've got some red ribbons, I think, yeah, on your program. I want you to look on the back of your program. If you have a DG, the initials DG on the back of your program. I want you to scream, holler, say, it's me, it's me. If you have a program, I'm sorry. Give Mr. Bernard a program. He took. All right, so here's what I want you to do. If you have a DG on the back of your program, you're going to get a nice bag with some goodies inside of it. Where's the bag, Shirley? They got to go all. Do you have to go now? You want them to go now? Okay, this is the first set of prizes. Hold your hands up. How many? It should be at least how many winners on this first round? 2. Should be 2. Stand up, my winners. 1, and where's the other person? Anybody spot her? Stand up. You've got a DG on the back of yours. Give him a hand. That's it. All right. Go to the back, please, if you would. See Dorothy. Miss Dorothy, raise your hand, Miss Dorothy, so they'll know where they're going. That's it, Mr. Hey, Miss Dorothy. Hey, looking good tonight. You're black and red. All right. So we got more door prizes a little bit later on. Do we want you to come back and do the second set next later, right? Okay, good. So let me take care of some housekeeping. In a moment, we will proceed to the front entrance area for the balloon release. Somebody shout balloon. Got a balloon release. All these beautiful balloons, but we have more, and we're going to release them to show our support for people living with HIV/AIDS. All right? And we're going to commemorate people who have transitioned. That's the word I like to say, who have transitioned or passed away. The red balloons, listen, the red balloons symbolize those living with HIV, and the white symbolizes those who have transitioned. As you proceed out, you take a red and or white balloon, if you will, and we will then gather in the front entrance area for the balloon release. Now we'll do that in about 20 minutes. Okay, I just wanted to let you know, do the housekeeping. We'll do that in about 20 minutes, okay, for our balloon release. So, and if I could, I still want to remind you about our HIV testing that is going on right now in the FedEx lobby. So, at this time, I think we're up to entertainment. All right? Is Anisha King ready? The band ready? Y'all ready to be serenaded? So what we're going to do is we're going to have some music from the band. You can feel free to mingle in the audience, say hello to someone, your coworker, and then after they play for a little bit, we will proceed outside with the balloon release. Ladies and gentlemen, Anisha King and the band. Give it up, y'all.
Mic check.
Put your hands together one time, one time. How about listen? I know a place, yeah. Ain't nobody crying. Ain't nobody worried. No, no. I see you, God. Ain't no smiling faces. Lying to the faces. Come on and let me take you there. I'll take you there. Come on and let me take you there. I'll take you there. Come on and let me take you there. I'll take you there. I know a place, yeah. Ain't nobody crying. Ain't nobody worried. No, no, no. Ain't no smiling faces. Lying to the reason. Come on and let me take you there. I'll take you there. Come on and let me take you there. I'll take you there. Casey, play your piano now. Casey, your feet. Let me take you there. I wanna take you there. Let me take you. I wanna take you. I wanna take you. Oh, let me take you there. I wanna take you. Oh, let me take you there. I wanna take you. Oh, let me take you there. I wanna take you. Oh, let me. Yeah, I wanna take you there. I'll take you. 1, 2, 3, and now give it up for the band. It's all right to clap your hands if you want to. I don't see no dance floor, but y'all still can groove a little bit. Come on, move your little hair, y'all. Come on. Listen, every superstition, right to the I see y'all. Every superstition, you know what? 13 months old baby, from the looking glass there, I see you. 7 years of midnight, put me in your place. But you know what? You believe in things that you don't understand, then you suffer superstition. Let me say it again. Every superstition. Every superstition. Yeah. Let her. superstition ain't the way. Superstition ain't the way. Superstition ain't the way. Superstition ain't the way. Take it on out, y'all. Listen. You believe in things that you don't understand, then you suffer. Superstition ain't the way. Y'all give it up for the band. Listen, we gonna take a small pause for the cause. Y'all stick and stay. Don't y'all go nowhere. Give it up for Lisa King in the band, y'all. Sounding good. We keep it moving for real like this. Going for real. Make sure you enjoy the Christmas Day FedEx Forum right here. Thank you very much. Shelby County Health Department, everybody here. Keep the music going real nice and smooth for you this evening. December 1, World AIDS Day 2022 program. Make sure you get something you like. You feel free to kind of get out and dance at your table, wherever you want to go. Make sure you see the vendors, consumers in the building. We got an HIV testing going on too, and we got a party. Here we go. Say it. Yeah, we're gonna get our warm up on. We're gonna get our line dance on in a minute too. Out to seat on the feet. If you feel good, wherever you are, make your own dance floor. I see if it's watching you do it around the woo. Everybody talk to me nice. Say now I love you, then people alive. Yeah, I love you, love. Yeah, we can do that, yeah, day and night. Yeah, if I leave, you cry. Yeah, if you leave, I will love me your body, baby. Love me your body, baby. Until I get your body, baby. So crazy. Love me your body, baby. Yeah, you are me to me. I just wanna let you know. You don't need no other body. Only you feel my body. Only you feel my body. You don't need no other body. Everybody say, no, I love you. This sounds good to me, FedEx Forum. This sounds good. Go Christmas, go. Not to sit on the feet. I see Lawson's Cleveland's back in the day. Hey, do it, girl. Give it all to me. Give it all to me. Give it all to me. Give Oh, yeah, I know it sounds good to you. Get ready for the balloon release in just a little bit, y'all. We're going to bring back Alicia King and the unit. Feel like yourself. We can go. Everybody finished good. Everybody got their balloons ready? About that time for balloon release, everybody. We're going to pick up our balloons real quickly. Veronica, you want everybody to get up now and head toward the rear, everybody. Come on, let's do our balloon release so we can come back in and enjoy the music on Alicia King. All right, so we're going to move on the count of three. I want everybody to stand up. If you're physically able, we're going to go and get our balloon release. All balloon people are waiting for you. 1, 2. Woo! Hey, come on, y'all. While you get your balloons, do it. All right. Shout out to everybody with the Ryan White program. If you go bundle up just a little bit, Doc. It's just a little chilly, but not that bad. If you're cold natured like me, you'll be all right. Make sure you get a red, white balloon. You know the significance of the red balloon and the white balloon. Red, those who are living with HIV/AIDS and those who have transitioned, you get the white balloon. Thank you so much, man. We're broadcasting live tonight on WDIA, by the way. Come on, Lisa. Get your balloon. Yeah. Get the white one now to match your hair, Lisa. Match your outfit. Thank you so much, Dr. Randolph. Thank you. Thank you very much. Elvis. Thank you very much. Dr. Bruce. Everybody come on, head on out. It's just a little nippy out on the porch, but it's okay. Thank you so much. Come on. Red and or white balloon. You know what to grab. When you head out the showcase, either red or white. Sure. Come on, can y'all hear me out there? All right, give me a red one. Talk to me, somebody. Jimmy Galloway, give me a red one. I need more. Mr. Galloway, you ready? You gotta project yourself. Hold on, y'all, for the release. Hold on.
All right, hold on. Be quiet for a second. Let's see. All right. Hello, everybody. We're going to get ready to go ahead and do this balloon release and we get y'all out the hole. Okay? First and foremost, we just want to thank you all again for coming out today to help us celebrate World AIDS Day. My name is Jeffrey Galloway, and I am the Planning Council Manager of the Memphis Brown White Office. All right. I can get for it, yeah! All right, stand. Cypress! All right, tell me what, I just want to personally thank you Yeah. One girl. All right, come on now. Let's keep going with. I just want to, first of all, thank y'all again. On behalf of myself and every person that's living with HIV across the world, okay? Yeah. Thank you for this day, because this is the day that we commemorate individuals that living with and have passed from HIV and AIDS. Yeah. So thank you all for joining us today to help celebrate those. What we're going to do on the count of three, we are going to release balloons in honor of those who have passed, okay? As you move out some more. As you release those balloons, if you know anyone that has passed from HIV, please call their name, okay? So on the count of three, we're going to go ahead and do this. We're going to make this video. 1, 2, 3. Thank y'all so very much. We're going to be praying this time. Thank you out. Yeah, y'all come on back in. Hey, everybody, guys, Andy Frank crew. Y'all doing a great job. Hey, y'all have been doing great. Come on back in here. FedEx Forum, Shelby County Health Department. Woo! Ending the HIV epidemic. Memphis Ryan White program, December 1. Everybody take your seats. Social line on your way there. Balloon release has happened. Woo! Hey. Lots of parts. That's good over there. Big speeding. The big boy. Do it. Hey, the girls and chicks. Come on in. We'll get back to the program. Get ready to eat. Dr. Randolph has blessed the food. In a minute, we're going to get back to the program. Hey, y'all, this thing we got going on. This thing we got it going on right here. Hey, I see you. Who we represent? This is the health department table. Who we got? Shout it out. Hey, West Memphis in the house. Almost feel like bringing out the roll call. East Arkansas in the house. Franklin County in the house. Over the bridge in the house. With the roll call. Come on, office manager. I got that one down. Woo-wee. Lisa, you good? You better get Bill Mike and walk around with you. I was watching you and Andy. You're not running the show back. So people are coming here, make sure get somewhere where you can socialize, have some fun, break free and get some money.
All righty, y'all. Ooh-wee. Yeah, how about that? Just in case. I think that's a 1 or 2. All right, Doc. Ooh-wee. All right, I'm going to come out here. All right. All right, y'all. Woo. Yeah. Grab you one, nobody sit like that. All right, so here's what we're gonna do. Let's thank Difford Galloway one more time, everybody, for facilitating the balloon release. DG. That's why we put the DG on the back. All right, so here's how we're gonna be served. Is anyone in here already 70 and up? 70 and up, 3 score and 10, and you proud, you physically able? Hang on, Veronica. Stand up, let me see you. If you physically able, you 70, you got the promise already. 3 score and 10, all over the building. Give a hand. Guess what? Y'all go first. Y'all eat first. Yeah, Dr. Taylor said, let y'all go. So y'all direct them to where they need to go. They're gonna be served first, all right? See there? First should be last, last should be first. Something like that. Hey, that's how we gonna do it. See there? Y'all two gonna be in and give them a hand as they come. We trust you this time. Y'all sure don't look 70. I trust you. You look honest, but you don't look it, but I trust you. 3 score and 10, that's all we're supposed to get. I said supposed to. But by grace and mercy, we might get a little bit more, won't we? All right, last call. Hey, ma'am, hey. Y'all, what if you what? 3 score and 20? How are you? 80? Well, that means you go there, girl. We got an 80-year-old right here. I'm in 80 exactly. Bless your heart, girl. Go ahead. You going to the front of the line. Tell them to get out your way. Seniority. Longevity has its place. Ooh, I love it. She 80. All right, okay. Next. 65 and up. Talk to me, somebody. You ain't ashamed. You're going to take your word in it. 65 and up. Come on, senior. Come on. Did you got but one? Hold on, I thought another 65 and up. That's it, y'all some babies in here. Green top, go ahead. Are you rocking that Kevin Green? You sure look good, girl. You by yourself in the line, in your own age group. All right, now, Veronica, where you standing, I want the 2 tables on each hand where she is. Look at Veronica right here in that pretty dress. That means y'all next. Y'all next. Don't wait too long now. Y'all want to eat? Stand up. If you physically able, you better go now. Forever hold your peace. I'm going to tell you how we're doing it. We rehearsed this last night, y'all. See if we follow through. All right? This table there and this table here, they going fast. If we didn't call your table, don't get up yet. Stop doing like the kids in school. Thank you, sir. Next group, 59 years old and up. 59 and up, come on. Where are you? She said, I fit in that category. Guess what? Me too, girl. I'm finna go eat. 59 and up, come on. If you're physically able, she run. Come on, Dr. Bernard. Spirit help. Get in line. Don't be afraid. Dr. Randolph, that's you? All right, sir. 5'9" and up.
I'm not talking about your height either. 59. Some people like, uh-oh, he's closing in on me. She said, she give me that look, he's getting close. And then somebody said, it's gonna be a while. All right, Sister Washington, where are you? She's standing by the table that go next. If you see on the left or right, say, look at Veronica, the lady with the pretty red, black, and red dress on, with the pretty braids. That means it's your time to go, right there. Watch how we do it now, on the left hand or the right. Come on, you got 6 seconds to move, or we're going to the next people. Don't try to blend in. We don't try to blend in with this crew. Thank you so much. Y'all looking good as y'all procession are out. Lady with the Delta jacket on, what you doing? Hey girl, the lady with the Delta Sigma Theta jacket, thank you. I'm gonna get to y'all in a minute. I see you. Ooh. You got the Greeks up in here. Go on, girl, let me see you. All right, Washington, where are you? Let's let him get situated. All right, ladies and gentlemen, you see where she's standing? That means it's time y'all go. Jason, that's your table, man. Get up, Jason. Still waiting on you. You're number 25. Like you 90 around here. Get up. Hello, Veronica. Did you get this table too? Or what they still sitting down for? Come on. Shelby County best. Yeah, come on. Yeah, come on, Doc. I see you. I like that attire. I see you. You got another one of them I can rock. All right. Hold on. Miss Washington, you still back here? Who going? Left side, right side. Y'all ready? On count of 3, get up. 1, 2, 3. Right here. I ain't rocking this. My turn. You getting all the good-looking people over there. 55 and up. If you are here tonight, 55 years of age and up, and you have not served yourself, it's your time. Stop playing like y'all ain't 55. Thank you for being honest. You right in there. You right in double nickels, girl. What about your husband? Okay, we ain't calling you, huh? I hear you like I'm young, huh? Okay, he ain't ready to go up yet. 5-5, double nickels. Hold on, Veronica. That's my crew. Here comes, thank you, sir. 55 and up. He said he gonna make it. If I won't hold this mic, that'd be my bracket right there. Talk to me, somebody. That'd be my bracket. But they say I can't eat till I get everybody up. Veronica, it's your time. Where you gonna wind up? The 2, left hand, right hand side. This table right here on the count of 3. Stay right there so they see where they are. Right here. 1, 2, 3. Come on, Anisha, before you sing some more. Get on, Sister King, AKA. Gonna get you something. AK in the unit. All right, y'all be patient. I know your stomach growling. We're gonna get to you. I'm gonna show you how we rehearsed it last night. Make sure we keep, hold on, Veronica, don't scare nobody. Now watch this. 26 years old and under. 26 and under. Your time. Don't be cheap now. 26 and under. Yeah, them little girls, let them go on. See there? You better be 26. Thank you so much, DST. Y'all let the kiddos have their take. See there? You try to go with the children. See there? 26 and under. So the kids say we not discriminating. We take care of the young folk too. Last time. 26? Oh, you got to escort him. I get it. You're coming back with 3 plates though, right? Yeah, I like how they do that. Parental guidance. PG-13. No, I get it. Veronica, who do we have? They beg you to stand by their table. Y'all be patient. I promise you coming. Lawson's, you good over there? All right. Next, ladies and gentlemen, 27 through 37. 27 through 37. It's your time right now. Going once. Look at the little baby. Ain't that pretty little old baby? My guy. Good job. Good job. You did that. You got a boy on the first go round. Boy, you cutting up. You couldn't look. I ain't got no kids. I don't know about all that stuff. I'm just saying, hey, what's up? She said he lying. Okay. Stop lying. Okay, I'm sorry. I lied. Veronica, wait, right here, left and right side, Arkansas. Y'all ready to eat? Come on count of 3. 1, 2, 3. Get up. All right, hold on, Veronica. Slow down, girl. I don't want the line too long. Monitor it. Got to monitor that line, girl. We don't want nobody waiting. We monitor the line as we do this. Let's do it like we did last night, Veronica. Like rehearsal. Come on, Arkansas. DST in the house. I see you. Okay, I'm gonna throw it to you. The Delta symbol. Arkansas, what's up? All right. We're watching the line, everybody. Hold on. Vendors, have y'all had anything to eat? Vendors, y'all good over there? Prep. Shelby County Health Department. Y'all been served? Take a break. All right. Watch the line. Hold on, watching me. My cameraman, got me on tape. I better not say nothing crazy. All right, that looks good. Hold on for a minute, y'all. Let them come on back. All right, take a break, everybody. Let me put some music on. I promise you I'm coming to you. All right, everybody, ready for the next group. 38 to 45. That's all you get. 38 to 45 years old. Sing the song. And when Veronica's standing, your table is ready there too. 38 through 45, and the table that Miss Watson is at. Sing the song while you wait, everybody. Yeah. Hey, Tanisha, go ahead, girl. Perfect doll in the house. Different. I like your crew. Keep on jamming. Okay, ladies and gentlemen, our next group is anybody who has not been served. It's wide open. Everybody who has not been served, it's your time to get up. Everybody, anybody, somebody who has not been served. No more age groups. No more Veronica Washington standing by your table. Everybody, it's your time. Thank you so much for your patience. Ooh, she got a pile up high, girl. Is that my plate? That look good. Thank you for your patience. Dr. Taylor, you've been served. They say they were coming to serve you, but if you want to do your own, that's fine. They weren't coming to serve you, but come on. You can do it. Got a lot of your sorrows in there. You must send an invitation out. They support you, Dr. Taylor. Everybody else who had not been served, come on. Shirley, you've been served. Get you something, Shirley. Lewis. See you, Brenda. Brenda Harding. I see my camera guy. All right, everybody else here, Shirley Lewis. You back good? All right. I think that's everybody. All right. Can I do it like this, y'all? Come on, sing. Hey, if you what? Come on, Ryan White program. Come on, sing it like y'all know it. Come on. Oh, what's the name of this song, somebody? What? Sing it real pretty. What you believe? Different. Sing it. Sing it, Shirley. Get up out your seat and sing that thing. Was a great one. You already know what to sing, girl. Sing it. Dance, dance, sing. Keep it yeah. Gonna bring that up food over here, lady. Keep singing, y'all. Over in the business section, they dancing. Do it, Veronica, come on. Oh, yeah, I like that song. Tell me, what's the name of this song? What's up, the man? Sing it. Yeah, strut your thing here. Come on, y'all. Sing it over there in that corner, y'all, too. Background, say what? Got the background down. Got it, baby girl. Pop, 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 but y'all keep singing. I don't believe what? I don't believe in that. Background. I believe in love. Sister Hardy. What's up, Brenda? You know the song, girl. Don't go put no what? No worries on your head. The what? It'll be all I'm talking about. You don't know what to sing. A little more back. All right then. This part I like to go back and forth. DST, sing. You ain't no fool. Oh, I know I ain't. I can't understand that, baby. Delta singing that thing tonight. Oh, like Rudolph Barrett. Elvis, go say it. I can fall down on my feet. Pull down without my sleeve. Ladies, your turn. I wonder. I'm talking about. Come on, operator. Fellas, your turn. You would disappear. Sing it different. Come back from you so long. Shirley, you know your mom. Sing it for her. She know it. She know it. Keep singing, fellas. 2 words. I'm available. Mean everything you say. Woo. I know this song. Come on, cha-cha. Lisa King and the unit, baby. Don't play with it. The band in the building. I hope that ain't on y'all roster, y'all playlist. I'm so sorry if I did. Oh, Lord have mercy. Go ahead and cut that off. Look, DJ's supposed to always check with the band. My bad. They go like, he said, I saw with y'all. It's gonna sound so much better when y'all sing it, though. I guarantee y'all. Get close up the ground, let me see you just push it up, push it up. One time by your table. Wobble, baby, wobble, baby, wobble, baby, wobble, yeah. One time by your table, take a break. Wobble, baby, wobble, baby, wobble. You can do it wherever you are. You do eating, whatever you're doing, it's all good. Do it. Get in there. All my panelists, get ready. All my panelists, get ready. We right on schedule. Now discussion coming out after we do this wobble, y'all. After seat on the feet. Go on, back it up. I'm shaking it, it's like powder, man. I'm shaking the city like do it different. I can go in the face like powder, I'm making the cake, so let's bake. Hey, I'm taking the game's mine. Yeah, I witness the change, it's my time. Yeah, I'm new to the game, but y'all might want to say you ain't perhaps they like saying the time. I can dance home. Do it, girl. Y'all looking at doing it tonight. Oh, man, I like that bench, baby. You rocking it, dog. Come on. Arkansas. And when it's over, you ain't gonna need your December 1st, World AIDS Day 2022. Do it, do it. To the front. We walk on the inside or the outside, in the middle of the aisle. Get in there. Get in there. Oh, you looking good, David. Do it. Come on, back it up. Come on. All over the building, the Grizzlies did. Go Grizzlies. Brian White program in full effect. Go back it up. Here we go. Girl, wobble it, and I'm a wobble it. I see you moving your head, go ahead, wobble it. We can go to the bed, straight back it. Arkansas. East Arkansas. I got it going on tonight. While I'm on my scripture. Come on. Here we go. I move with the letter pencil. She doing it. That's like stand up, back it up, girl. Yeah, put yourself to the test, girl. Put yourself to the test, girl. I like Arkansas. They ain't scared. They ain't never scared. Get in there. Come on, Brenda Hardy. Go on, back it up, Brenda. Go on, back it up. That's what I'm talking about. Hey, do it, Brenda. Go on, back it up. Go on, Hardy. Go on, back it up. That's right, girl. Hey, she ain't never scared. She ain't never scared. That's what I like about Brenda. Come on, break it down. Oh. Kevin Green sweater. Oh, back it up, Kevin Green sweater. Back it up, folks. That sweater so pretty on you.
All the shorties in the club, let me see your chest. Back it up, drop it down, let me see your chest.
Tell Scooter where you
Let me see your chest. Push it up,
I need some barbecue right about now.
Wobble, wobble, shake,
Oh.
shake, shake, give it here. Wobble, wobble, just push it.
I like that.
Show me what you got, show me what you
I
got.
like that.
Show me what you got, show me what you got.
Sound man, he got it. Audio engineer, he got it. She got it. Go on, do it. Yeah. Do it. Go on, back it up. That's what I'm talking about. Never scared. Dr. Bernard, May May. How you doing? Dr. Turner. Hey.
Wait a minute.
Spirit in the building. Spirit in hell. Come on. Wobble one time, May May. That's Sarah, ain't it? Hey, so even Sarah. Yeah, I was looking at that red dress last year. Girl, you moving on up like Georgia Weezy. You moving on up? Yeah, what it is, ain't it, Sherry? I
All right, y'all, give yourself a hand, y'all. It's the Grizzly Den. How's the food? Food good? I may get to eat during the panel discussion. Hey.
Mic check,
We got
check,
a good program lined
check,
up for you.
check. Mic
I
check,
think,
check,
Veronica, we're
check.
just about ready, are we?
Mic check.
If we're on schedule, let's do it like we rehearsed last night. Is it 7 o'clock yet? We want to make sure we're in time. It's about 7, yeah. We're right on schedule. We're getting with our panel discussion, everybody. Keep it moving. Thank you so much, y'all. And we are set to go. All right, ladies and gentlemen. It gets greater later. Then we're going to come back with Anisha King and the unit. Tell you how to book them and give you some information about how to book the greatest entertainment that you'll ever want to hear. Anisha King and the unit. Anisha King Music at gmail.com. Ladies and gentlemen, we please give up for our moderator. Go over the panel discussion, going to take us a little higher in the program. Veronica Washington!
All right, thank you. All right, so we're going to move on to our panel discussion. I'm going to introduce each of our panelists. Our panelists are members of our HIV Care and Prevention Group, our Planning Council. I'm going to start with Lee Barrow. Lee Barrow earned a bachelor's degree in education and a BSN from East Tennessee State University. Lee is currently a graduate student at UT Health Science Center, working towards her MSN. Lee has worked in surgery, geriatrics, and quality assurance. She was awarded the Edward Gardner Award for Humanity in 2021, and Lee has served on the HCAP Planning Council for a number of years. Thank you, Lee. Come on. Dr. Roy J. Sessom. Dr. Roy Sessom is an ordained minister, writer, author, educator, manager, father of 2 adult sons, openly gay, HIV positive professional. He has dedicated himself to doing the massive river of work that God has chosen him to start, be a part of, and or complete. He has chosen not to be ashamed, defeated, or intimidated by his life choices. He earned a bachelor's degree in business administration, marketing from University of Memphis, an MBA from Dowling College, a Master of Ministry from Jacksonville Theological Seminary, and Doctor of Ministry from International Ministry College. He is working on multiple projects with a new book coming out soon. He is a current HCAP member. Let's welcome Dr. Roy J. Sessom.
Thank you.
Dr. Crystal Walker joined the faculty of the UTHSC College of Nursing in January of 2016. She earned her bachelor's degree in biology from the University of Mississippi in 2009, and she is a 3-time graduate of UT Health Science Center, a Master of Science in 2011, a PhD in nursing research in 2015, and a Doctor of Nursing Practice as a family nurse practitioner in 2016. She worked as an oncology nurse in an inpatient setting from 2011 to 2014, and her background in oncology supported her research interests as her dissertation focused on the prevention of anal cancer and people living with HIV. She works in HIV primary care, and her research focuses on HIV prevention, medication adherence, sexual health, and nursing education. She currently practices as an advanced practice nurse at Regional One Health and Adult Special Care Clinic, a patient-centered comprehensive clinic for adults living with HIV. And she has presented locally, regionally, and nationally on her research topics of interest. She has also published manuscripts and received grant funding related to HIV, sexual health, and nursing education. She is a member of the Association of Nurses in AIDS Care, Shelby County HIV Care and Prevention Group, and serves as an advisor to the UT Health Science Center College of Nursing Black Student Association. Let's welcome Dr. Crystal Walker. And last but not least, Tamika Wren. Tamika Wren is a certified life coach with 15 years of experience with diverse populations in outpatient settings with a focus on people living with HIV and AIDS, at-risk populations, and families affected. Currently, she serves as the Director of Outreach and Linkage Services for Hope House Memphis and is the co-owner of Radar LLC. Tamika, or Mika, is focused on developing quality services and increasing access to medical and supportive services in underserved communities. Thank you, Mika. We have an amazing group of panelists today. And I appreciate each of you for agreeing to serve on today's World AIDS Day panel. Each of you bring a wealth of knowledge, experience, and value to the work of the Memphis TGA Planning Council. This distinctive planning group, under the management of Denver Galloway, Planning Council Manager, plays a vital role in determining our community needs, organizing resources, and setting priorities and allocating Ryan-White funding to achieve improved health outcomes for people living with HIV and other vulnerable communities. This year's World AIDS Day theme is putting ourselves to the test, achieving equity to end the HIV epidemic. It is imperative that our efforts to end the HIV epidemic locally address the stigma, discrimination, and social and structural factors that fuel HIV-related health disparities. Lee, what is the current reality of health and well-being of people with HIV where you live, work, and serve?
Okay, I'm going to refer to my notes if that's okay.
No problem.
People living with HIV continue to encounter many barriers to equal access to testing, medical care, and the support services that they so desperately need.
Anyone else? What is the current reality of health and well-being of people with HIV where you live, work, and serve?
So I think currently it's a lot of fear. I think that in the current climate, we haven't done a great job telling what HIV looks like in 2022. And so what that looks like is that we have a lot of fear of what HIV looked like in the 80s. And right now, people living and affected by HIV, they live in fear daily.
So the Ending the HIV Initiative aims to reduce new HIV infections nationally by 75% in 5 years. Therapeutics exist that can both prevent and treat HIV, which means eradicating the disease is achievable. However, we are failing to ensure that communities most affected by HIV are optimally supported in prevention, testing, and treatment, which Lee, you touched on. So how do you define health equity for people with HIV? Mike. It's on.
Hello. Okay, so when I think about health equity, I think about people having equal opportunity to get the care that they need. And so that's the definition of health equity. The problem is that everyone does not have an equal opportunity to get the care that they need. So we say, hey, we'll put a clinic here, we'll put a hospital here, we'll make sure that we're prescribing PrEP over here, we'll make sure that we're prescribing HIV medications here. But then that doesn't mean that people can actually get to those locations. It doesn't mean that people have the food. Let's say food is required to take those medications. It doesn't mean that people have the resources, the food, the finances to be able to take care of themselves. So health equity is a buzz term right now. And we tend to forget about the actual people. Like we'll put the places in place, we'll put the medications there, but we forget about the people.
Okay. So what about the social factors that influence the health and well-being of people with HIV?
I think she just named a few of them: the transportation, funding, even people paychecks. So you've got to have those. Just population knowledge. If those were in place, then it could be a lot better. You take those of us that, let's say, have the transportation, our income is okay. I mean, my 8-year experience has been absolutely outstanding. The care, all the benefits, it almost seemed like the stigma of it being bad has almost been, I was foolish in getting it, but the benefits with it has been a blessing.
Mika?
So I'm gonna go back.
Okay.
One question. Health. I think what it looks like for us right now is that we want to walk into clinics and be inclusive. We want to be unbiased. We want quality health services. And yes, we do put clinics and access in impoverished areas, but if I walk in the door and I'm not treated well, if I walk in the door and the care is not quality care, we want to have the same level of care in South Memphis that we have in Germantown, that we have in Collierville. We deserve that. And so I think that's what equity in healthcare looks like right now. That's what we want and that's what we need. And as far as the social factors that influence health and well-being, I think right now it's just stigma. Stigma is very heavy, definitely in the South. And because of that, I have seen people who would literally rather die than present for medical care. And that's just, it's unfathomable when we can overcome this epidemic. But until we're doing that in an inclusive way, an unbiased way, in a way that's acceptable for everyone, we're going to continue to have the disparities that we have here.
So, Tamika, you kind of touched on this a little bit about the impact of stigma and that we hear stigma, but then how does that really impact the individual when it comes to their care and their treatment?
So from what I've seen, I have worked with individuals who are at a point where if they decided to take medication and adhere to a regimen that normally potentially looks like one pill a day, they would be healthy, thriving individuals. But because of stigma, that one pill a day they would rather die than take that one pill a day. And that's what stigma looks like. Here in the Bible Belt, it feels very different. And when I go to other places and I hear how well they are tackling HIV and getting ahead of this epidemic, the huge difference is geographical. The fact that we are in the Bible Belt and we're not tapping into our natural resources. We have a church on every corner. This building should be filled with pastors. This should be filled with people who are on board to keep individuals alive and healthy.
Lee?
Well, I just wanted to say one thing and give a shout out to all of the many people in this room, including myself, who have worked so hard for so many years to overcome stigma, and we are doing great.
Mm-hmm. Yes.
So I was going to add to some of those social factors. I think the one thing that we don't really like to talk about is structural racism. And so I'm as you all can see, a Black woman. And so when I walk into a healthcare center, there's already stigma about who I am, what I do, who I've been with, how much money I make, just because I'm a Black woman. And so when I walk into a place and they see me, there's already judgment. There's already thoughts about who I am before I even open my mouth. And so when patients go into healthcare centers or healthcare clinics or wherever they're receiving care, and there's the stigma is there, it's right there before they even open the door. Patients feel that when you're being stigmatized, you can feel that, right? So people feel that when they go in those places. And once I get that feeling, I'm done. I'm out. And this me, Black, educated woman. If I go into a place where I feel like I'm being treated unfairly because I'm a Black woman, I'm not going back. And so that's not any different from somebody living with HIV. If you go into a place where you feel stigmatized, why would you go back? And if that's the only place you can get care where you live, then you're not in care. And so that's how stigma can affect healthcare outcomes for people living with HIV.
And I think my part of that might be a question, but with the stigma, how can we overcome within? Now, I can answer the question, but isn't it an individual where we have to be able to be bold? I'm okay with who I am. Mm-hmm. I'm okay with being HIV. So it doesn't matter what they say, but I know everybody else is not there.
Yeah.
So you're touching on, there's this external stigma, but then we have this internalized stigma as well that can prevent us from care, going to get care, taking our medication, even sharing and having support and connections with others, because I've internalized this stigma that's like stopping me, that's creating this little block for me to keep going. So I think that's an important thing to point out.
Let me say this, and this is a little deep, but I'm going to share it. About a month ago, I had to go to a doctor, nice area, but everybody know going to this doctor, it's an OBGYN. So why would I be going to an OBGYN? Rectal. So the lady on the elevator said to me, well, I hope you're not pregnant. I said, well, I don't think I'm pregnant. And I just rolled with her and just laughed. I'm okay. I'm okay with who I am. Yeah, I'm there for the rectal doctor. Everybody know. But everybody is not there.
Yeah. There could have been someone who received that same message and went right back downstairs.
Absolutely. Absolutely.
And that's the impact of stigma. But I was ready. But just that one comment, you know what? I'm going home.
Yes, yes.
So here in Memphis, Memphis is now ranked third in new HIV infections by metropolitan statistical areas in the United States. And the highest proportion of new HIV cases are among males, those 20 to 34 years old, Black non-Hispanics, and same gender-loving men. So why have we been unable to make sustainable progress in achieving health equity to end the HIV epidemic locally?
Well,
go ahead.
Okay. So as a healthcare professional and as an educator in an academic institution, I think we have done a very poor job in our academic institutions of teaching healthcare professionals how to be with patients. Healthcare professionals have this, we tend to think that we hold all the power. So when you come to see me, I tell you what to do and you're supposed to do it. Like we take the power away from the patient. And I'm not saying that we're taught to do that, but we're not taught not to do that. And so a lot of it has to do with how our healthcare professionals, students, and just professionals in general are trained. And it continues to go back to stigma, and it continues to go back to bias, because if you have a healthcare professional who is not open, who is not willing to see you for who you are, then you lose them. And so I think we've done a terrible job, not just locally, but nationally, on how we're educating healthcare professional students. And I've recently just had a grant funded, shout out to the Tennessee Department of Health and EHE 901, shout out to y'all. But I just had a grant funded where we're going to be looking at educating healthcare professionals on how to be with patients. It's very easy for us to teach people how to write a prescription. I can teach my 4-year-old how to write a prescription, right? But I cannot teach him, because he's too young, I can't teach him how to actually interact with patients, how to have some therapeutic communication, how to let your guards down, how to lose that power that you've been taught to take into the examination room. So I think it goes like all the way back. We tend to put stuff on the patients, but we play a big role in this as healthcare professionals, and we need to do a better job.
I think that we haven't done a great job in education in general, not just with our healthcare professionals, but with everyone. I sit in a lot of different circles with a lot of people that know a lot of things, but they don't know what PrEP is. They don't know what PEP is. Like, everyone should have those words in their mouths, on their vocabulary, telling to their children, in our school systems, all of those different things. And so it's about education. And I believe that if we as a TGA work to put education out there, this should be a common conversation. When we think of cancer, we talk about St. Jude readily. We love them. They do great work. And just like we have those comfortable conversations about the marathons and things of that nature, we should be able to have comfortable conversations about HIV. But if we are not educating the public about what HIV looks like right now, they don't know. If everyone in this room is the highest level of professional that you're going to get, everyone outside of here knows nothing about HIV but what they Google.
And I would say also, due to lack of education, we might need to work on slowing it down first, then work on ending it.
What do you mean by slowing it down?
Slowing the spread of it down. We're talking about ending. But due to the lack of education and information, let's work on slowing it down, get enough information out there that some foolish choices won't be made.
All right, last question. So at the most recent Round White Conference, I heard a new coined term, which was new for me, disruptive innovation. And to me, that emphasizes the need for new approaches, new thought leaders, new interventions. But with that, there's this underlying question when it comes to disruptive innovation. Are we willing to go there? Are we willing to break down some walls? Are we willing to get in people's faces? I mean, audaciously. And perhaps that is the test. So how do we need to think and act differently to accelerate progress towards health equity?
Start with people with HIV being willing to come forward and talk about it and share it. You have a lot of people with it that they themselves are not willing. They're ashamed. So if you start there, then build a platform with your churches and community, because a lot of time in the churches, we won't talk about it. We won't touch it. It's just so bad, but we might as well. We're talking about it and doing everything else. So yeah, but I think if we start with people with it, enough come forward.
It's kind of like, I'm going to add to that, kind of like a Me Too movement. And so I'm sure many of you in the audience are familiar with Me Too, when people would come out and say that they had been maybe sexually assaulted, and then that gave other people the courage to say, well, me too. It happened to me too. It happened to me too. LGBTQIA plus movement, as more people start coming out and saying, hey, I'm gay, hey, I'm bisexual, hey, I'm same gender loving, we start to see more people coming out. We start to see it on TV shows. Every TV show I watch, there is a same gender loving couple, and I'm perfectly fine with it. But the more that we see it, the more it becomes like normalized, right? And so I agree with you that the more we see people, like I'm so glad when they introduce you, or she introduced you, and she said you are a person living with HIV, and we do need more of that, because people out here who may be afraid to say that I'm living with HIV can see you and be inspired by you. So you are absolutely right.
And I'm going to ease this in. After a 26-year marriage and divorcing and deciding to walk in who I am, and I don't say this because they're here. Are they still here? Let me see. Is Pastor Duke still back there? And Dr. Clemens. And the first thing I did when I decided to live my truth, now even while I was married, Dr. Gooch is a pastor, Dr. Clemens, first gentleman, I secretly watched their services, even while I was married. So when I decided to walk in my truth, that's why I say it's important to have others. That's the first place I decided to go. I said, well, to help me walk in my truth, let me go on over to Dr. Gooch's church. So I went somewhere where there was a comfort zone. There was a comfort level to help enhance me.
So I would say we can accelerate progress by tapping into our community as a whole and finding our common ground. We have a lot of community-based agencies and organizations, and everyone has their purpose, their goal, what they're fighting to be at the top of the food chain. However, I think we can all agree that we all can get behind an effort for people to live. Yeah. And if we work with agencies and come to a common understanding that this is not about one person or another, that this affects everyone in some shape or way, then what we develop is a common goal of people, and then we move forward. But I think all the resources that we need are already here. It's here, it's on the ground. We just have to bridge the gap and be willing to sit down and have the hard conversations and learn how to put people first.
Elgin added beyond one accord.
So disruptive innovation to me looks like meeting people where they are. When we talk about health disparities, we talk about transportation and food insecurity. There is no reason in 2022 that we should, and I work in a clinic, I'm a clinician, there is no reason that I should be, or we should be requiring people to come to us if they can't. Right? If they can't come to us, why do we make them come to us? I have no idea why we are not like in mobile health units all over this city. Like going to South Memphis, Mississippi Delta. I know that's outside of, Memphis, but there's no reason that we can't do that. We just get stuck in the way that we've always done things. Like you got to come to the clinic, you got to get your labs, you got to come back in 3 to 4 months. No, you don't. No, you don't. I could come to you, and if I needed to get labs, I can draw them, or I can bring a phlebotomist with me. Like what? I would rather get in my car and serve people who have these health disparities than have them come to me. That is such an inconvenience, and so I think that's one way we can disrupt the system.
Absolutely.
Then somebody give me some money to do that. I need some money. That's the other problem. You can't really be too disruptive because disruption requires money, and people aren't willing to fund the things that differ from what they've done for so many years. Like you want to have a mobile clinic out of your car? No, you're just going to have them come to Regional 1, go to Spirit Health. Let's just do that because that's what we've been doing forever. But yeah, we got a little way to go with disruption.
So when you talk about we've got to start thinking about things in different ways, I think the COVID-19 pandemic brought forth that idea that we could do things differently and still get the work done. So I think we're in a position where we're starting to say, hey, there's new approaches to things, there's new ways to do these things, and we can still do what we need to do. But then even with COVID-19, we've got some of those who are pushing back. And I'm particularly talking about working from home, because I would prefer to work from home. But I know I can still get my job done. I don't have to be or are tied to a building, and care doesn't have to be tied to a building.
I don't think so.
So each of you have highlighted opportunities to accelerate progress, including meeting people where they are, putting people with lived experience at the forefront, galvanizing us behind a common movement, and to accelerate the progress of ending HIV epidemic, to address stigma, discrimination, and structural factors that burden Black families, same gender loving men, our youth, our women, our cis and transgender women, and the time is now for this disruptive innovation.
Yeah.
And I wanted to mention disruptive innovation because I think there are some people in this room who need to hear that's where we're headed. That you're going to start hearing some strategies and interventions that go against what we have always done.
Yes.
And we've got to be open to it.
Yes.
We've got to be open to it.
You know, I think about Uber all the time. The very first time I took an Uber, my mom was like, that's the craziest thing you could do is get in a stranger's car. She's like, who does that? But now Uber is everywhere. There was disruptive innovation, right?
Yes.
And so we got to start thinking like that. It's bizarre. It was in the beginning, but now it's like normal. And so if we just step outside the box, we got to step outside the box if we want to see something different.
We've got to open the doors to some new leaders, some young folks who have new ideas. The young folks must be reached. We've got to get them involved. And a part of that is addressing the stigma around it, because our youth is influenced by that stigma. I had a conversation with my mom about this event, and so she was asking me, like, what would the turnout look like? I'm like, I'm not really sure. Because this is not like breast cancer where we can, woo, 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 get excited about it. There's still this stigma just to come to an event like this.
Yeah.
So, it takes a whole change in dynamics and how we approach this epidemic. And so I appreciate each of you sharing your expertise. I do want to give each of you an opportunity to give any lasting words, anything else you'd like to add.
Every individual person has to be able to walk in who they are and not be ashamed. It still starts there. Break barriers of what people are saying and just be who you are. It doesn't bother me what people say, because when I step in the room, I step in. When I sit at the table, I know something about everything. So, and let me get this shout out since I'm talking. Y'all go out and get my book come March 2023 and listen to the title, The Other Woman is a Man. March 2023, my book, Dr. Roy Sessom, will be on the market.
I'm gonna look out for that one.
I had to get that in.
Yes. Well, again, I thank each of you. The work that you do with the HCAP Planning Council, it means a world to all of us, even if we don't know it. There's a lot of people who have no clue what's going on. And you do it without recognition oftentimes. And so I really appreciate each of you. I appreciate what you bring to HCAP, the fact that you volunteer. These are volunteers. You volunteer your time, your effort, your expertise to serve a community that oftentimes is left behind. So again, thank you, thank you, thank you.
Thank you, thank you.
Give them a round of applause.
Just exit.
All right, let's get for our panelists one more time, y'all. Let me y'all give it up for our panelists. Thank you for your time and your expertise.
That's good, that's good.
Okay, so I think we have the door prize. Did we get all the door prize out on the first shirt? I think we got some more door prize. We didn't do that last time when we came back into the little release. So let me try to get that in before we bring up our entertainment. So we're gonna have a line of purple boys meet you where you are, and Cameron, if you want to follow me, good. But we heard from our panelists, and we just want to thank them so much for being so transparent this evening about what they are going through and what needs to be done, and hearing from you all this evening. I think it's vitally important that we listen to what they had to say, and not just hear them, but listen to them. So I want to thank all the panelists, from everyone, all the doctors and the people who are living with HIV, and Roy, Crystal, thank you so much. Yeah, thank you. I heard the passion in your voice. I heard it. So that's what it's all about. The first duty of love is to listen. First duty of love is to listen, and we love each and every one of you. Thank you for being on the panel. Thank you, Veronica, for facilitating and moderating this. All right, while the band kind of gets ready, we've got some prizes we'd like to give away and bestow. So it looks like, okay. Is this the part where we're going to 3 yellow circles on the back of your program? Sure, yeah. If you have your program and you have 3 yellow circles on the back of your program, would you raise your hand, wave them in the air, wave them like you just don't care? Yeah, they get fresh, yeah. Stand up now for me so we can see if we got it out. All right, should be 3 yellow circles on the back of the program. I see your hands. Who else? 1 yellow circle. We're going to do it 3 different times. Hello, somebody. Yeah, I can do my homework. All right, so just 1 right now. I went over there. They need to see Dorothy. You want to see Dorothy and claim the prize? That person, Dorothy, wave your hand so they can go and claim their prize right now. Give a goodie bag. There's Dorothy in the back. Stay right there, Dorothy. Let's see you, baby. When I see you, you go straight to Dorothy. Do not pass go. Do not collect $200. Go directly to Dorothy. Get your prize. All right. Okay, good. I want to make sure I get that's a special prize in the black bag. Okay. and the bonus gift is they win a meet and greet with Denver Galloway, y'all. That's a special meet and greet. You give a gift, good till you win. Y'all can hook up and meet and greet and talk to them 1-on-1. I didn't say 101. I said 1-on-1. Now that's a grand prize right there. Get the city chat with Denver Galloway. All right. Yeah. So again, thank you, Veronica, interim deputy administrator, the Ryan White program. Maybe we'll get the interim out of here in a little bit and make it official. Come on, talk to me, somebody. Something about that interim. I'll be like, how long I got to wait? I remember the interim DJ for the Bobby OJ show. Interim. How long I got to wait? So I waited a little bit, and then, they went on and gave it to me. All right, okay, not interim. I want the long term. But no, it's good. Speaking of that, those of you who listen to Bobby OJ, raise your hand. That's my guy. I just want to say, being transparent, it's an honor. I'm thrilled. I don't take it lightly. I know I have a job to do in that seat. Those of you who listen to WDIA, I just want to say thank you, and I will continue to improve and again and put his legacy out there and do it the bell ringer style. All right, but thank you. It's the bell ringer show. It's the roll call. So just want to say thank you. Every time I get in front of an audience, sometimes I do want to let you know there is some bit of humility there sitting in that space for Bobby OJ. So thank you so much. All right, we're up to now the Light of Hope Awards presentation. Am I on schedule with this thing, Sister Terry Lewis, Jimmy Jam, Terry Lewis? All right, so who's gonna bring it up? Let me flip my script a little bit. Cause I done got kind of stuffed with them steamed collard greens, whatever that was over there. It was so good. Had that mac and cheese over there and some of that good chicken. I get a little sluggish. Dr. Randolph, there's your time? Okay, you come on, you know what to do. I'm the only one down on the floor. I want you to be on camera up there. All right, so the Light of Hope Awards will come now. Dr. Randolph will facilitate that and make his presentations, all right? Hear ye him.
I wanted, is this on? Everyone hear me? Okay. I want to just take this moment to thank all of you who are here and participating in this grand event. And as being the administrator of the Ryan White program, I personally want to thank the staff, the team, the Ryan White team, for all that you've done. Once again, you've put on a great, great event. I'm very happy, and you should be very proud of yourselves. You know, each year, the Shelby County Health Department recognizes an individual, business, and an organization in the community that has demonstrated activities to increase awareness and understanding of HIV/AIDS in our community by awarding the Light of Hope Award to the deserving recipient. And so the recipient as an individual, the individual recipient this year is Shireen Mazumder. She is an infectious disease expert at UT Medical Hospital in Memphis, Tennessee. Dr. Mazumder holds active board certification in infectious disease and internal medicine and is in active clinical practice for over 17 years. She received her medical degree from Rush Medical College, completed intern medicine residency at Rush and infectious disease fellowship at the University of Tennessee Health Science Center. Dr. Mazumder has extensive experience with various infectious diseases. She has published over 30 articles in various medical journals and served as a reviewer and editorial board member for over 15 medical journals. She is a member and fellow of the Infectious Disease Society of America, fellow of the Society for Healthcare Epidemiology of America, and is a credentialed HIV specialist through the American Academy of HIV. Dr. Mazumder is the 2022 Memphis Flower Exceptional Woman in Medicine Award recipient. So it is with great honor that we bestow upon you the Light of Hope Award as an individual. I present to you Dr. Shireen Mazumder. Come on. Where are the awards? Oh, I was wondering where the awards, but here's the award. Okay. Great. So again, on behalf of Shelby County Health Department, we present you the Light of Hope Award. And as Jesse Jackson used to say, continue to keep hope alive.
Thank you.
And you're going to take a picture.
Thank you,
Anything to say?
Yes.
Yes.
Thank you so much, Dr. Randolph, and thank you to the Shelby County Health Department for this honor on this special day. And World AIDS Day is such an incredible and important day because it allows us to come together and show our support and promote awareness and acceptance. And I have had the honor of taking care of people living with HIV in Shelby County for over a decade. And I want to take this opportunity to thank my patients for allowing me to care for them and allowing me to play a part in their lives. And one of the major factors in why I went to medical school and pursued a career in infectious diseases is to provide care for people living with HIV. So this award is very, very dear to me and very close to my heart. And we've come a long way in the last 4 decades, but we still have work to do to expand treatment, end discrimination, expand care, and promote acceptance. So thank you very much for this great honor. Thank you, Dr. Randolph, and thank you to the Shelby County Health Department. Thank you.
Thank you, Dr. Mazondo, and we pray that you continue rendering such a great service. The next award goes to an organization. The East Arkansas Family Health Center, known as the EAFHC, is a vital healthcare provider in Eastern Arkansas and has been a stable provider of healthcare services since 1974. They are dedicated to providing accessible, affordable, and quality healthcare to underserved populations in Crittenton, Poinsett, Mississippi, and Phillip counties of Arkansas, and Shelby County, Tennessee. They offer a wide range of specialty services, including primary care, women health care, pediatric, chronic disease management, dental, ophthalmology, and HIV management. They also offer HIV case management services, which include HIV education, payment for medical and oral health care for the underserved, assistance with the cost of medication, nutritional counseling with a certified nutritionist and nutritional supplements. They also provide food and utility assistance for residents of the Crittenton County, Shelby, Fayette, Tifton counties in Tennessee, DeSoto County, Marshall, Tunica, and Tate counties in Mississippi. They offer transportation assistance to medical, dental, mental health, and some supportive services appointments, as well as they provide referrals for mental health, drug, and alcohol rehabilitation, housing, and utility assistance. So on behalf of Shelby County Health Department, under the leadership of Director Michelle Taylor, it is my joy and privilege to present to East Arkansas Family Health Center the 2022 Light of Hope Award for an organization. Will you come? All right, congratulations. Yes. Did you step up? There you go. You gotta be the sport. gotta speak.
Good evening. We're going to make it real short. On behalf of East Arkansas Family Health Center, we'd like to say thank you. And we also like to ask all the clients/patients to help us as a clinic to do better to fight stigma, and also to inform us in the areas that we are weak. That's the only way that we can grow and help this population. Again, thank you.
And we thank you, East Arkansas Family Health Center. Continue the great work that you're doing and continue to keep hope alive. The third award that we give, the Light of Hope Award, goes to a business. And the business that we would like to acknowledge this evening is CVS Specialty Pharmacy. CVS Specialty Pharmacy focuses on high-cost, high-touch medication therapy for people with complex disease states. Medication in specialty pharmacy ranges from oral to cutting-edge injectable and biological products. The disease treated ranges from HIV, cancer, multiple sclerosis, and rheumatoid arthritis in rare genetic conditions. CVS Specialty Pharmacy assists with health needs wherever and whenever there is a need, and they do it from the heart. Their passion is their purpose, bringing their heart to every movement and every moment of health. They deliver personal and expert care based on the needs of the individuals. Their mission statement is to improve the lives of those we serve by making innovative and high-quality health and pharmacy services safe, affordable, and easy to access. Their vision statement is, we strive to improve the quality of human life. Their core values comprise innovation, collaboration, caring, integrity, and accountability. It is with great honor on behalf, again, of the Shelby County Health Department under the leadership of Dr. Michelle Taylor to present to CVS Specialty Pharmacy the 2002 Light of Hope Award. Would you please come and receive? Sure.
I will also keep this short. On behalf of CVS, thank you. We do love to lead from the heart and look forward to serving our communities. Thank you all.
Well, thank you all again for your service and the commitment that you've made to making Shelby County and the surrounding counties and state a better place. Now, I turn it back over to the master of ceremony, Mr. Stan Bell.
All right, so, all right, thank you so much. One more time for Health Director, please.
Some respect out of it.
All right, so this, since Tuesday is giving time, it's giving time even on the Thursday, right?
We got some free stuff for the giveaway. I think it's a final round of the giveaway. We're going to do about entertainment, and then we'll have Manager Denford Gallery to come and give us some closing remarks. We'll have a little fun as we go along. So I'm going to give away some stuff. It's giving time. What have to be on the Tuesday, and we'll be on the Thursday. All right, so I'm going to ask, I think, what is it, the circles in the back now? Of the blue circle, that circle on the back of your program. If you are that person, if you stand up, waving here, make some noise, we got to get the right here. We got to look in the further. Don't look in the further. Look what you got. You got to see if you're looking at the right side. Oh, baby, on the blue circle. Darky, would you wave your hand in the back? Somebody coming your way. Congratulations, you got the big prize for you. The white pass. Dr. Iman and Dr. Marcel right once again, and then going back and back in the beginning. There you go. Hey, Dr. Tan, I see you. Hey, Marcel. Hey, Morgan. Hey, Dr. Iman. Okay. Y'all ready to go? Two more time? Oh, we got a lot of the guys on you. I believe that. Let me see if they can hear. Okay, come on, give it up another woman. Y'all did a big in this year, but you know, look at the back, waving her hand back there, looking like Sade, saying something, you know, like paradise, smooth out the road, you're a winner. I got all your albums, so good. I even got that one on cassette when you first came out. I said cassette. All right, one more, it's another one. Hold your hand, keep waving your hand. Like in church, I see your hands. Hold on. But you can all three out the way. One more person with the blue dot on the back of the program. Come on. They're still here. Dorothy, we got, how many you got so far? How many, Dorothy? 2 of them, 4? You got them all? All right. Okay, so I think we're on schedule. Thank you, sure, keep my timekeeper. All right, so Dr. Graham, congratulations. I worked in the last name and last night, I couldn't, I tried. I did, even if it wasn't, you know, I saw it. Is it really okay? Congratulations. You know what? Before we kind of go into it, I want to say thank you to you particularly for, I felt your heart in all of that, what you said up there. We've done a lot of work, but we got a whole lot more to do. We got a long way to go. And I felt that when you said that, there's so much work that has been done, but what you said, we got to keep the hope that we can get it done. So in other words, you put it right what I've always said of these particular events like this Ryan White program. It's all about hope. We've done a lot, we've got a long way to go. So to me, hope is an acronym. Hope is an acronym, having only positive expectations. Yes, we've done a lot, but we've got a long way to go. But if we have hope, we can get it done. Am I right about it? Having only positive expectations. So thank you for the work that you do. You and your team really appreciate that. Thank you. No, thank you. And your family for being here with you. It takes a family. All right, so with that being said, I'm going to bring up Alicia King and you maybe he said to do that thing. If it is a good time, come on, welcome the Planning Council, the PCM, I call it, the Planning Council Manager. Mr. Jimmy down the road, and really close the remarks, he's got a yoga's job. He's got a yoga's job. Really not doing like you did. And he's sorry to y'all. And he really, part my girl name is taken. They were Good evening, everybody. Again, thank y'all for coming. First and foremost, give yourself a round of applause. Because without you all, we couldn't make this happen. We just wanted to, are we done giving out the giveaway tonight? Okay, too bad. I want to give away something else. But I'm going to give away that Mercedes you drive. But now, thank y'all for joining us tonight. We really appreciate you all for coming. We will be back again next year. So we will be calling up on you all for your support all next year. Because we got a lot of work to be done. We have done a lot, but we got a continuous amount to do, okay?
So with that said, don't forget about Mr. King. So if you want to stick around for a little while and enjoy the music, please do. Other than that, good night, be safe, and we will see y'all later. All right, thank you, Mr. Cowboy. Y'all ready to party? Say yeah! We got this alignment and table. These people on stage, they are not only just around members, but they play the Mid-South Region, they play all over. I went to the see a lot of people dipping in left and right. I went to the U, I went to the dip, left and right because they do it. They play a lot of people that Mr. King and the unit! We ain't gonna get blind down. We're gonna keep this party going with this stuff. You know me? What? Come on, we playing with hands with your love too. Hey, I said it's alright to be close to playing with. Let's do another little second hand down. Listen. I'm gonna live in the ways. Give me the big hand, I say. I think they're hard to play with me. Give it all you want of me. I just want to say it's right. Girl, I'm driving the big to me. What you feel it's not there. Love me now, baby. Yeah, don't you know what you do? Don't you know what you do? Yes, you Yes, can I say the second verse now? Listen. I can't see what I'm not. It's so to know the time I'm ready to decide. What you need, the love will lead up to something. The words that I don't know you brings us singing.
Make sure you put the name for the next year when they do a graduation. Aware of the best quality of our mixed from where you can put back around all back and come to the funeral now and say when you next stay open. Well, I'm gonna do you one of these here. Can I do it right now? This is my see. Somebody say, hey Sean! Come on, Sean! I'm sorry you don't be here now. Come on, bring it in, bring it in, bring it in. We ain't gonna go sit in now. Let's go there and do it. Come on. Rob, sit in it, baby. Just let us go now. Let's call it shooting back to Friday. Let the movie hit and break and bring back the time. Take it back in the time and take it back. It's like a movie. Let's get it. It's going to shooting back and back. It's a money of all your feelings. And you just from left to right. Put it in the mind of your feelings. It's on the inside, yeah. Take it to the brain, take it to everybody here tonight say, I want to see you. You're going to hit the floor running. Everybody say up in names. Everybody say up in names. Everybody say up in names. Can you say this? We got to have these things down. Let's win this one time. I will do the way we say now. I was wondering if I let this We're going to do this. I'm gonna say yes for speaking and staying the name. I promise you a good time, not a long time. So until next time, let's go. I'm seeing you. Make sure you make the name. Y'all be safe. Good night.